Okay, we're going to now talk about 3 other tests. We're going to talk about the passive abduction raise test. And with this test, you guys, I'll demonstrate this test on Emily and Stephanie here in a minute. This test is a test that's going to test the ability for the femur to abduct. And the femur can abduct, the outlet's got to be able to adduct. So if we go in a left AIC pattern, and if my left inlet's going forward, and my left outlet, if I'm going into left iliopubo external rotation, and I'm going back into ischiopubo internal rotation, and if my left outlet is in a position of adduction, my left femur can do what? Abduct. But on the contralateral side, on my right side, my outlet is in a position of abduction. So if I passively take the right leg and it can't come up, it's because my outlet cannot do what? Adduct. I really want you guys to understand this test and the pelvic ascension drop test. The pelvic ascension drop test is the inability for my outlet to do what? Abduct. This is a test with my outlet's inability to adduct. Because how is my test going to be different if this test is positive and my pelvic ascension drop test is negative? What's going to guide my treatment? So in a left AIC pattern, we would expect for this test to be positive on the right side because my outlet is in a position of abduction. So my femur isn't going to be able to abduct. In a PEC pattern, if my pelvis is coming forward and both outlets are going into adduction, this test should be negative on both sides. Because my outlets are going into adduction, my femur should be able to go into abduction. In your patho-PECs, it could be positive or it could be negative. But it's going to be because of a bony position. Because if they maximize in range position, and if the acetabulum goes and covers the femoral head, it's going to be hard for them to be able to abduct because of how the acetabulum is facing over the femoral head. It's going to get stuck. If that is positive, you know you have someone that's at maximal in-range position. They have a lot going on. But I cannot look you guys in the eye and let you know if your patho-PEC, if they have any test that's out of the ordinary with what we'd expect, it's pathology. And we would normally expect for that test to be what in a PEC? Negative. And if it's positive, you know you're dealing with someone that has a lot more pathology going on. Okay? So, any questions with the passive abduction raise test? So I'm going to demonstrate it here in a minute. I'm going to go through all the tests, and then I'll go through and I'm going to demonstrate it. But do you understand the biomechanical reasoning with why it's positive or negative in a left AIC PEC and patho-PEC? So in a left AIC pattern, a passive abduction raise test, we would expect for it to be positive on which side, left or right? Left or right? Right. In a PEC pattern patient, would we expect for that test to be negative or positive? Negative. And a patho-PEC, it could be positive or negative depending on what you find. If they're pulling this over the femoral head, it's going to be a bony restriction. They're maximizing in range position.